views and comments of the hosts and guests are not necessarily those of the station.
Hi, I'm Nicole, Jacinto. Join us on Healthline with 𝗏𝗏𝗶𝗵 as we discuss the latest health and medical topics with doctors from 𝗏𝗏𝗶𝗵. For a healthier and uplifting lifestyle, tune into Healthline with 𝗏𝗏𝗶𝗵 on DZRJ 8:10 a.m. Radio Bandido TV. You've got questions, we've got answers.
Watch and listen to Healthline with 𝗏𝗏𝗶𝗵, Mondays, 5 p.m. to 6 p.m. Airing on Sky Cable Channel 224 and on all DTT boxes. Simulcasting online on Facebook and YouTube. Listen and watch on your mobile devices. Just search DZRJ Radio Bandido.
You're about to experience Healthline, a show where doctors from 𝗏𝗏𝗶𝗵 interact with you for a healthy, uplifting lifestyle. Moderated by Nicole Jacinto. You've got questions, we've got answers. So welcome to Healthline.
Hi, everybody, and welcome to Healthline with 𝗏𝗏𝗶𝗵. I'm your host, Nicole Jacinto. Happy Easter, everyone who celebrated Easter yesterday, who are still celebrating Easter today in other parts of the world. Happy Easter to you guys. Thanks for viewing. Thanks for watching. And also, it's Easter Monday here, so the whole week is actually still Easter. And today on our show, we're going to talk about bipolar disorder with Dr. Charm Bernardo. Hello, Dr. Charm. How are you today?
Good afternoon. I'm cool. How are you?
I'm okay. It's good to see you again.
Yeah, good to see you too.
You're always welcome to guest on the show. So many interesting topics and things we can discuss with you. I know you're very pressed for time, so thank you for joining us today. It's good to raise awareness. And okay, so Dr. Charm, let's get into it. You are a mood order specialist, so you are a psychiatrist, yes?
I am. Yeah.
Okay.
Yeah, and I am a psychiatrist. That is my specialty. Then my subspecialty is actually mood disorders and anxiety.
Okay, mood orders and anxiety. Well, anxiety. Okay.
Here we go again.
Here we go again. No, but I think we should really do a lot of shows about mental health because especially since, in the last few years, our mental health issues have really arisen, or there's been a rise in it. And of course, a lot of that has to do with the pandemic. Like, it may be over, but for us, things have changed. Anyway, Let's talk about bipolar disorder in particular today. Can you give us an overview of bipolar disorder?
Okay, well, bipolar disorder, as the term implies, bipolar. So there are two poles. Yeah. So my mentor in the States actually will always have a statuette of polar bears, two polar bears, because it's polar, bipolar. So what we term is the North Pole and the South Pole. So the North Pole will be the hyperactivity, wherein they're manic, the mood is elevated, they feel euphoric, they're distracted, they do a lot of risk-taking in behavior. They're not able to sleep because there are a lot of things going on. For them, actually, one of my patients would actually tell me, "Doctor, sleep is just a waste of time." So yeah. So they have a lot of spending sprees. They're very impulsive. They're irritable. So that is the North Pole, the hyperactive part. Now we have the South Pole. The South Pole is the depressed part, the depressed mood. They don't want to get out of bed. They just want to lie down. They either oversleep or not sleeping also, but because of the insomnia, their mind is blank. They have suicidal ideations. Their concentration is also thrown out of the window. They feel very lethargic. They're withdrawn. They don't have any interest in doing things that are pleasurable. So that is the South Pole. And of course, the first one is the mania. That is the North Pole. So bipolar consists of two very major swings in the pendulum. You know, the hyperactivity, then we have the very low mood. Now, what is interesting is that we also have in psychiatry what we call major depressive disorder. criteria for major depressive disorder is actually just the same as the criteria for depression in bipolar.
Mm.
The thing that makes it bipolar is the presence of the North Pole, of the hyperactivity of the mania. When
Yeah.
it is there, then that major depression becomes a bipolar disorder. So
Thank
that's
you, doctor. What a great explanation and analogy because okay, bipolar disorder is different. Yeah. Okay. Basically it's like as you said, you're very, very up or feeling high, doing, things, and sometimes that entails like risky behavior, which we can talk about a bit more later in just a minute. And then there are times when the person is just so down, like they're very depressed. And as you said, there's major depressive disorder. But usually they're just depressed.
yes.
Like it's the
They don't have
down,
that. Yeah,
down.
they don't have the highs. So that's
You
a
know,
major depression. Once the highs appear, then it's bipolar. Yeah.
okay. So but can I ask you a question? Like sometimes the people who have major depressive disorder, they will push themselves and be able to function and but do you consider that like do you take that into consideration in your diagnosis? Okay,
Yeah.
yeah,
If
yeah.
they go, if like for example, they're depressed, then
Mm.
they become functional and then it's okay. But once they start having spending sprees, once they start having impulsive behavior,
Mm.
once they feel like they're Superman or Wonder Woman and that they could do anything and leap buildings in a single bound or something, or they become very distracted, very talkative, then
Mm.
they're now fulfilling the symptom criteria for a bipolar. So it's not stable anymore. They are now swinging into the opposite realm. Yeah,
Yes.
because for us, it's very important that we want as much as possible for the mood to be fine, okay? To be normal, to be stable. So what does that entail? Like, for example, hey, if a favorite pet die, of course, all of us will be sad. But after 3 or 4 days, the mood will go back again, and then you will be functional and able to do stuff, Or if you win an award, so of course you will be very happy, you will be okay. But then after 2 or 3 days, then it will go back to normal again. Here,
Yes.
with this state, their extremes, they're able to sustain it. For depression, for 2 weeks. For mania, usually 1 week. They're like that. They're just doing things and they're fighting with everybody. And of course, the functioning is again affected for
Yes.
both of them. Yeah.
Yes. Okay, thank you, Dr. Charm. And then, can you tell us? I know you've mentioned them already, but what are some of the common signs and symptoms? Maybe you can go a bit into it, like as you mentioned, the risky behavior.
Mm.
Just to elaborate more on, on what exactly, like, how can you tell that someone has bipolar disorder?
Okay. Usually our mood is okay, but for them it's like I feel like I'm on top of the world.
Mhm.
Doctor, I feel so good even if there's nothing going on. It's an ordinary day, but I feel like I can do 10 different things all at the same time. That kind of thing. Or, with my job, with all of those people, they can actually replace them and I can do them all at once, just me. So the grandiosity is there. That is what we call grandiose behaviors. Another would be distracted. They're easily distracted by things. They're doing one thing and then one thing will attract their attention, then they're doing the other thing, and then the other one thing will attract another attention. That's
Mm.
what we call distractibility. They're easily distracted. So at the end of the day, they're starting a lot of things but not finishing anything. So
Okay. Is it
yeah.
doesn't that come, let's say you have ADD or ADHD too,
Mm.
that like be mistaken? Like how do
So
you
here, yeah,
distinguish?
there's no mood problems in ADHD. So
No.
here you have I feel, hey, I'm the only one who could do all of those things.
Okay.
I have spending sprees.
Mm.
I just spend. I max out my credit cards. I sometimes go into debt. I'm very irritable. In ADHD, it's really more of the intent of the attention, the inattention, and the hyperactivity. But
Yes.
here, you have a lot of other mood symptoms. Another thing is, yeah. So as I've said, it's the increased goal-directed activity. By 10 p.m., they're still at it.
Yeah.
I would have patients wherein at 3 a.m. they're cleaning the swimming pool. This is in the States. Or
Yeah.
doing laundry. or doing the dishes. Okay, one prime example of the impulsivity and spending sprees, because in when I was training abroad during the dead hours from around 12 to around 6 a.m., usually there are a lot of infomercials. So
Yes.
so my
I'm a
patients.
night person, I mean, naturally, so I get it. And then when I was a student, I'd do my papers at night or
Yeah,
whatever. So,
correct. So my patients, when they come in to the clinic, they would say, "Doctor, I maxed out my credit card." So I was interested, what goes on, and
one
then they
night,
say,
yeah, yeah,
the infomercials. So I decided to watch. Because
yeah,
what's going on with the infomercials? Why do they need to
yeah.
spend? And then it's the urge, spend now to get $30 off. So there's always like that. So they get into it, and then they buy stuff, and then they buy stuff, and then they buy stuff.
I
So
mean,
that,
like,
yeah,
it can happen to anyone, even a normal person, when you go on a spree. But for people with bipolar disorder, it's most likely really exaggerated. Like in
yeah,
one night, you maxed out your credit
correct.
card buying like
It's
a
very
mop,
impulsive.
a
It's
magic mop, and
yeah,
also some towels
the
and
magic bullet. So,
three
but
kinds of food
yeah,
shoppers, because you're gonna
correct.
give some to
Yes,
your family and whatever, and
correct.
then you would
Yes.
set up your whole
So they
kitchen.
get hooked into it, that they need to buy it. Another, and this is actually, well, we had the World Bipolar Day celebration, and this is one of actually the topics that I had during the time. It's the bipolar symptoms that nobody talks about, and it's hypersexuality.
Yes, I was gonna ask you about that. Okay.
Yeah. So, again, this is a favorite anecdote that I would say during my lecture. So, when I was there, I had a patient who was actually fine, doing just fine. And then, I don't know, about a week before she went into the clinic for her regular checkup, she started becoming manic already, not sleeping at night, have a lot of thoughts and everything. So, during the day of her supposed to be appointment, she had this very she cannot keep it down, sexual urges. So
Yeah.
she's having sexual urges at around 3 a.m. So
Mm.
in the States, we have the 24-hour Target, we have the 24-hour Walmart, that kind of thing.
Yes.
So she went to a 24-hour Walmart. She
Mhm.
got herself a man,
Yeah.
and she was able to do it. And she was on time at 8 a.m. at my clinic. And she was
Yeah. Yeah.
just like smiling. And one of us was happy, but I wasn't the one who was happy, during the time. But that's the how impulsive they are. Together with the lack of sleep, they don't need sleep. Doctor, sleep is just a waste of time. I only need 1 to 2 hours of sleep a night. It's like go, 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 go. It's like the Energizer bunny. They just keep on going and going and going. So those are the kinds of things that
Yeah.
we see and we have to notice in bipolar, especially the mania part. Another would be the hyper talkativeness. So they're very talkative.
And
So
they're not usually like that. Like it just becomes
correct,
super
correct, yeah,
exaggerated.
correct. And actually, relatives will bring them to the clinic, and they're hoarse because of nonstop talking. And then all of the relatives will be like, really haggard looking and everything, because they're not able to sleep because the patient keeps on talking to them all
Mm.
throughout the night. So they will be brought to the clinic. So usually it's like that when the hyperactivity. Of course, it doesn't take away from, again, very important for me, the effect on functioning. They fight
Yes.
with all of their family members. They get into quarrels on Facebook. That they destroy. Yeah, have a patient destroys the paintings of the inside the house. So it becomes like that. The problem is, once we get them out from the mania, once we stabilize them, and then they're out, then they start wondering, why are my friends not talking to me?
Mm.
Why are they avoiding me? And then they will see actually what was going on Facebook, what they were posting and everything, and then the depression will set in. Usually it's like that.
Is
Yeah.
there also a sort of selfishness associated with the manic activity? Like,
Mhm.
you will not knowingly, but essentially bug someone, bug them, bug them, but it's all about them.
Yes.
Then and also so stop talking to them because it's really selfish, or they get into arguments, they don't understand, they hurt the feelings of somebody else.
Correct. They contradict, or they attack the post. an opinion, then they will attack it and incessantly, even if friends were already telling them to please stop it. You're already going beyond your boundaries, but still they will. So that gets them into trouble most of the time.
And
Yeah.
then does this also do bipolar people with bipolar mood disorders, do you have to give them some type of anger management later on, or that's totally different?
Maybe later on, especially if they're still irritable or hostile after you have stabilized them, then they might need to. But the thing is, they might not ask for it.
Yes, they don't understand. Yeah. I
Correct.
mean,
Yes.
how they
That is a
behave.
problem. That is a problem.
I wonder
Yeah.
if one of my exes is listening to this. I know you stalk me, so there. Anyway, okay, I'm not making fun of people with bipolar disorder. Okay, I do have friends who have it, and it's good when it's on a friendship level because
Yes.
I understand them, they understand me, but there's some boundaries, and I
Yes.
really want to like try. They really don't want to push it, but I understand. Okay,
Correct.
so
Yeah.
all right. So okay, I was like kind of getting ahead of myself with the anger management thing, but I was just curious about it. And you know how I am. I just like talk. So when somebody is like maybe some of my friends appreciate that I can actually talk and talk and talk to them, and make sense out of something. Or
Yeah.
maybe like kill them with my talking. Okay, are there different types of bipolar disorder? Do they fall into like are there like one is this type, the other is that type, and the other?
Mhm. Yeah. We actually have around 4 or 5 types of bipolar disorder. We have the type 1, okay? We have the type 2. I'm saying it because there is a reason for it that I'm just saying it all at the same time.
Sure.
Number 3 is what we call cyclothymia.
Mhm.
Okay. Number 4, of course, it's bipolar secondary to a general medical condition. Number 5, it's a bipolar secondary to a substance use, shabu, cocaine,
Okay.
etc.
Could you go through them, doctor? It's really interesting. And then
Yeah,
to know that there are other underlying causes also, like it's
yeah,
not simply the disorder itself, but something else. Okay, so
yeah.
let's type 1.
The thing is, all of the criteria is the same for all
Mm.
of them. Yes,
But
it's the same. The thing that makes them different is the timing, how long it has been present, and the effect on the functioning. So for your bipolar ones, the same as bipolar 2, for your cyclothymia, of course, for general medical condition, there is a medical condition that's going on, like thyroid problems, or maybe other serious medical conditions that would increase your adrenaline. Of course, for substances would be ecstasy, cocaine, shabu. But the symptom criteria for all of them is only one. It's the
you.
same for all. Okay. So as I've said, it's the elevated mood and the increase in the goal-directed activities. It
Mm.
is accompanied by your distractibility,
Mm.
what we call racing thoughts. Racing thoughts are actually, my patients would describe it as thoughts that are coming in a mile a minute. So when a thought would enter your mind, immediately it goes out and it's replaced by another thought. It's racing. So
Okay.
usually my patients actually have a notebook. They need to write all of their ideas down because it's zipping by so fast that they forget it the minute that it's out because it's being replaced by another thought. That's very common in bipolar. Then,
Thank you for making that distinction. Yeah.
yeah, the number 4, of course, the problems with sleep. So I'm
Mm.
very particular, especially with regards sleep. So I would tell them what time they go to bed, what time they actually sleep, and what time they wake up, because going to bed, going to sleep are two different things. So one of my patients, I just had that patient today would go to bed at 10, would sleep at 6.
6
So
a.m.
yes. So it's 10 p.m., sleeps at 6 a.m. So I thought, what the hell are you doing, with that time? I don't
Trying
know,
to.
Doctor. It's just that a lot of thoughts are coming into my head,
Mm.
and all of these thoughts excite me. So
Yes.
that I'm not able to sleep. So usually the racing thoughts would happen during the time that they're not sleeping. So I'm very particular regarding that. Okay, then we have the increased risk-taking activity, the risk-taking behavior, and some irritability or restlessness. They feel so wired. They feel that they like to do things. They feel like, again, they're like the Energizer bunny. They just need to keep on going and going and going. So for bipolar 1, bipolar 2, the cyclothymia and others, it's the same. That's the criteria. Okay. Difference is for bipolar 1, the mania, the symptoms, all of them, or most of them, they have a criteria, last for at least 1 week. And the functioning is affected. So they're fighting with people, they're assaulting people. That's why they're brought to the emergency room and that's why they're admitted. They're shouting, screaming, throwing things, banging things. So functioning is already affected at that time. For bipolar 2, usually symptoms would only last for around 3 to 4 days. And then they will be okay again. And yes, there is some problems with regards interpersonal relations because usually they're very irritable, but not enough to affect function. They're still able to go to work, they're still able to do their activities, they're still able to go to school, that kind of thing.
So that's bipolar 2.
That's
Yes.
2. That's a type 2. So the same. When we go for cyclothymia, usually symptoms only appear for like 1 day and then
One-
disappear. Yes, and functioning is actually not affected. They're not able to fulfill the criteria for your bipolar. So maybe what is only present would be an elevated mood. They feel grandiose and distractibility, but nothing else. No impulsivity, nothing. So they don't fulfill criteria. So they go to that category. Now, again, for general medical condition, you have like, for example, goiter, hyperthyroid.
Yes.
It will make you manic.
Yes.
So that. And the substance, well, one example would be, again, our substances. Another would be steroids. Steroids can actually, roid rage and everything.
Yes. Make you
Like,
angry or yeah.
so it does
Sorry, that's how my ex was. So diagnosed it, dude. I told you to see someone. Hope you did. And then the fifth, of course, is substance abuse. So like it comes from taking, like, if you, does alcohol play a role?
Alcohol is more of a depressant.
Yes.
It depresses the mood. It seems as if when you're under the influence of alcohol, you're very disinhibited. There's some people who are like that. But once the alcohol levels start going down, then they become irritable, they become depressed, and usually that's where bad things occur during that time. Yeah.
And then, because we also, okay, and then let's say it's marijuana but THC, or they mix it with alcohol, but those are depressants.
Yes. Mm-hmm.
If they take cocaine or shabu or any,
Those are stimulants. There's some uppers. Yeah.
so that's also when they, like, that's when they can have this mood, the manic mood.
Correct. Yes. When they're high on stimulants. Although marijuana can sometimes induce mania. But most of the time, what I see in my practice is marijuana inducing anxiety, panic attacks.
Wow. Okay. But how about the medical marijuana or the CBD?
Yeah, CBD. Well, we're still out. The jury's still out because if you think about it here in the Philippines, it's still illegal.
Yes.
Yeah. So I haven't encountered that much yet with regards to marijuana. But what I can say, because there are some, they need it in order to calm down. That's what they say. It interferes. It actually interacts with my medications, my mood stabilizers. So as
Okay.
much as possible, I really don't. Yeah.
Yeah. I mean, it has to be one program or another. And
Correct. It can't be both. It cannot be both.
so, doctor, what are some of the most effective treatments that you have for people with? Okay, actually, no, I want to go also like talk about the risky behavior. I want to go back to that because, you mentioned that you had a patient who went out and got a man, and it's hypersexuality. Now, it's not because we're being prudes, but
Yeah.
it's not that. It's just that, if you go out and then like there are people who have bipolar disorder who will go out and find whatever and find a man, and then what if he's hurting you? What if you get killed? What if it's a serial killer or whatever it is? Or what if you're not careful? What if you get pregnant if you're a woman? Or what if you get a disease? So that's risky behavior too.
Correct.
What if
Yes.
you're giving away all your information to someone you just met because you had a
Correct.
time. So that I just wanted to clarify that with people because we're not being prudes here. These things are the behavior is risky because you haven't thought it through. And
Yes.
it's not just an impulse or oh you fall in love and have a one night stand or whatever that is. It's like you just cannot be stop yourself. So you go out and do something dangerous.
Mm-hmm.
Okay.
Yes, correct. Yeah. There's
Okay.
actually a study that was done, although they only had 5 participants. This was in Denmark. This is a very recent study, I think in 2023. What they found out was that in mania, so there are like 3 women and 2 men who were involved in that study. So it was a lot of interview that was done. What happened was that when the women, they were manic, fortunately, they actually recognize it that they're being hypersexual. So what they do, they actually divert it to their passion projects, art, that kind of thing. So they become very creative. So they're able to channel it. Now, for the men, of course, what they will look for partners to be with, but the motivation is actually very different. So for them, whenever they would become hypersexual, they're actually looking for intimacy. They're actually looking for companionship. Yeah. But also very important is that when these people are manic, the sex really, the choice, the gender doesn't come into play, whether
Okay.
it's male or female. That's why I was telling our participants that for you guys, if you're a patient, you tell your doctors because you're psychiatrist, because you might be thinking, hi, I'm female, pumatol ako sa babae, baka isipin ni Doc, tomboy ako, or lalaki ako, pumatol ako sa lalaki, baka isipin ni Doc, bakla ako. No, because when you are manic, the gender doesn't matter. You're just looking for companionship. You're looking actually for someone who would take care of you, who would be able to
And it's
understand.
like, expressed in a sexual manner. Like it
Yes,
has to
yeah.
be physical. You need
Correct. So I'm encouraging, and everybody's listening. Everybody, please tell your doctors what's going on, especially when you're in a mania. I'm getting ahead of myself, maybe, but in a depression, it's also very different. For women, of course, when women we are depressed, no sex. They really don't feel any urge, nothing. But for males, they actually still look for it, but the quality is very different. It becomes negative. It becomes towards them more nasty, more cruel. So in a way, more masochistic, if you think about it. So that
so
is what happens.
masochistic for them. So they like
Yeah.
have sex with women who put them down or
Yes.
something like that.
Yeah.
Or
It's the focus now becomes very negative. They still look for it, but the quality of the sex is negative. Yeah.
okay, like they want it tends to or not they want, but it tends to become like a woman who's like, didn't enjoy it or something,
Yes.
or you're not good enough. Like just
Yeah.
make feel bad about themselves.
Yes. But here there is a sense of being nasty or cruel to themselves. So maybe hurting
Hurting them.
themselves. Yeah.
So that's like a manifestation of hurting yourself that goes along with
Correct. Yeah.
suicidal thoughts or doing harm to yourself or those feelings.
Mm.
And with women, it's like nothing at all.
Nothing. Yeah. So there it's like, okay, I'm depressed, so no urge to do whatever. Yeah. So it may be part of the anhedonia when they don't have any pleasure in doing pleasurable things that they found pleasurable before. But for men, it's quite different. Yeah.
I'm so glad you made that distinction and you explained that and that, we can talk about this. And as you said, tell your doctor if you have the disorder because you like what you said, like some people like, oh, doc might think it doesn't matter. Your doctor doesn't care whether and if you don't trust your doctor, find another one, right?
Yes.
Does the doctor
Correct.
heterosexual, bisexual,
Yeah. And
gay, the whole alphabet.
correct.
Yeah. And
Yeah.
sometimes
Yes, sorry, but also it's very important because it's actually overlooked. It's not talked about because as the first symptom that comes out in a mania, usually it will be hypertalkative or being distractible or the sleep. But and this occurs in less than 25% of bipolars. Usually for this group of people, the first symptom that came out was hypersexuality in teens. So during their teens, they were looked up to because they were very experienced sexually. Pero yung pala, it was already anemia. That is the first symptom that came out. So please discuss this with your doctors. Be open. That's why we're also having this. I'm glad to be here so we can talk about these things freely. Yeah.
And now I feel like, did some of those people who hit on me, of course I didn't give in because I'm hard to get. I'm just kidding. No, actually I am. So now I'm feeling like, did some of those people hit on me? Were they actually attracted to me, or were they just looking for company?
I think so. I think they're attracted.
Okay, it's not important. I mean, whatever, But see, that can happen too. Okay, so like if you're a good friend to someone and they have the disorder, and then suddenly it seems like they're hitting on you.
Yeah.
Don't take advantage naman. It's
Yes, correct. Yeah.
yeah. So there, kasi they have friends, right? And groups of friends, or
Yes.
so sometimes be a good friend. Anyway. Okay, so thank you for discussing that at length, because there are things that seem to be taboo until to this day. There's stigmas, but again, I am getting ahead of myself. Let's get to that in a bit, and let's talk about maybe we just have to take a short break, doctor, really short, because this is such a great and interesting topic, and I know that a lot of people would want to learn more about it. So we'll just take a short break, and then we'll be back, and then we can talk about treatment, medication, all of that, and the things that you apply, and how people can maybe help themselves through your guidance. Okay, so guys, we're just going to take a short break, and we'll be right back. And you're tuned into Healthline with Makati Med on DZRJ 810 AM, Radio Bandido. And you can listen to us anytime, anywhere in the world. And you can keep watching Dr. Charm Bernardo's this episode to keep learning if you need something repeated, okay. That's to my ex too. Okay, all right, doctor. We're just gonna take a short break. We'll be right back.
You're listening to DZRJ 810 AM. We'll be right back after these reminders.
Hi, this is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable at Makati Med Care Access, Araneta City. What's more, Makati Med Care Access is the only single-use hemodialysis center in Araneta City. It's now easier for patients to avail of renal care services right in the heart of 𝗂𝗏𝗁. We offer health screening and diagnostic procedures in this facility at affordable rates. You can get services such as mammogram, ultrasound, lab procedures, ECG, and many others. We believe that access to affordable, quality, and compassionate healthcare is a basic human right. And we at Makati Med Care Access Araneta City are doing our best to make this possible to more people. You can find us at the ground floor of Manhattan Plaza Tower 1 in Araneta Center, 𝗂𝗏𝗁. We are open from Mondays to Saturdays from 7 a.m. to 5 p.m. and Sundays from 7 a.m. to 4 p.m. For inquiries, you may reach out to us at the numbers below. We look forward to serving you here at Makati Med Care Access, Araneta City. This is Dr. Jacinto from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with the heart is now more accessible and affordable through Makati Med Care Access at 𝗂𝗏𝗄𝗏. Available for outpatient care services, our 𝗂𝗏𝗄𝗏 site offers consultation and diagnostic procedures such as medical assistance, hospital admission assistance, blood pressure monitoring, laboratory tests, and X-ray, among others. This is really convenient for those residing in Makati and nearby areas who do not want to go to the hospital to have these treatments and procedures done. We believe that access to excellent quality and compassionate healthcare is a basic human right, and we at Makati Med 𝗠𝗸𝗁 are doing our best to make this possible to more people. We are open from Monday to Saturday at 8 a.m. to 5 p.m. at the third floor of 𝗠𝗸𝗁 in Makati City. For inquiries, you may reach us at these numbers. We look forward to serving you here at Makati Med Care Access 𝗠𝗸𝗁. Hi, this is Dr. 𝗂𝗍 from Makati Medical Center, and I'm happy to share that our world-class quality healthcare with a heart is now more accessible and affordable via Makati Med Mobile Care Access. As the name suggests, this service is mobile, which means that we go to where you are. Mobile Care Access deploys a team of professionals for face-to-face consultations and to conduct basic laboratory and diagnostic procedures, as well as vaccination and testing, depending on your needs. We can go to any location of your choice within the metro and readily offer these healthcare services to communities or groups. For added convenience, different modes of payment are available, including HMO benefits for those with a valid letter of authorization. We believe that access to affordable, quality, and compassionate healthcare is a basic human right, and we at Makati Med are doing our best to make this possible to more people. For inquiries, scheduling, or pre-registration, you may reach out to us at the following numbers. We look forward to coming to you and serving your community with Makati Med Mobile Care Access.
You're back with Healthline, keeping you healthy. Moderated by Nicole Jacinto.
Welcome back to Healthline with Makati Med. I'm your host, Nicole Jacinto, and we have Dr. Charm Bernardo with us today. We're talking about bipolar disorder. So Dr. Charm has given us the symptoms, the behavior, and how even the classifications of the 5 different types of bipolar disorder. They all manifest the same, but there's a few differences in the time it takes, and just as you said, like there are some symptoms that are there. That's how you differentiate the type, and also like if there's an underlying medical condition like hyperthyroidism, of course you'll be hyper, or your adrenal, I don't know, you're just releasing a lot of adrenaline for another medical condition, probably. I don't know, please correct me if I'm wrong. And then also there's the substance abuse. When you take a lot of substances that make you, basically they're uppers, and then you mix all these things, you can become bipolar, have the mood disorder. So doctor, can I ask you, just based on that, before we talk about like how you manage and treat patients with bipolar disorder, once you're diagnosed with bipolar disorder, are you bipolar forever, or can it switch, or are there misdiagnosed cases sometimes?
Oh, okay. That's a very interesting question. Yes, it's a lifetime diagnosis. As with all psychiatric conditions, we don't have cures for it, but we can treat the symptoms. Okay, so it's like having hypertension. There is actually no cure for hypertension, but there are medications that control the blood pressure. So it's like that in psychiatry. So for bipolar disorders, yes, it's a lifetime diagnosis. Now, does it change? Does it shift from a 1 to a 2, for a 2 to a 1? No. If you're a 2, you're a 2. If you're a 1, you're a 1. Okay. But for example, a 2 would have trauma, sexual trauma or something, or would take a substance and everything. And then the manifestation of the symptoms is a 1. Then that patient becomes a 1. Okay,
Okay.
but usually it's triggered by something that's really that would really disturb the nervous system of a particular patient. So that is what happens when a two becomes a one, because it's triggered by either substance or a adverse event that or trauma that happens to the patient. So usually that. Then of course, what are the other questions with regards the? I hope I was able to answer the first
Did
two.
you did.
Yeah, yeah. So usually that's the
Just
case.
just to clarify even more, like, okay, so let's say someone becomes bipolar or gets the mood disorder because of substances. What if they stop? Do they get cured? No.
Okay, so what if they stop? Okay, then usually we have a time frame. The prime time would be around 1 month or 6 weeks. Once you stop and then mood symptoms abate or disappear, then it's because of the substance. But once you stop, but the mood symptoms continue, it's bipolar.
Mhm.
Okay,
Okay.
beyond the prescribed. So it now becomes it's triggered by the substance. It becomes bipolar. Yeah.
So of course, when you treat it, you also like, how do you get it? Are you born with it? You mentioned trauma. Can trauma create it? And when does it usually manifest?
Okay, very interesting. Again, the risk when it runs in families,
Okay.
so if your great grandfather had it, so most probably you have a gene. Now, if there are your environment is so chaotic, so toxic, and trauma filled, violence filled, and everything could trigger it. It's an environment thing. So we have the perfect storm coming up,
Mhm.
but sometimes the surroundings or the environment is okay, you don't have any genes for it, but there is something that happened while in your childhood, trauma, PTSD, or post-traumatic stress, a sexual abuse happening. It could actually trigger a bipolar and for you to become bipolar. Another would be like, for example, if you have like a medical condition that's
Mhm.
long running, and again it would give out as bipolar, the symptoms will come out. So those are possibilities also. So it's not only the genes, but also the interaction between the genes and the environment, your body. So those are very important in bipolar disorders. Yeah.
Just like other illnesses,
Mhm.
sometimes, as you said, I always hear that from doctors. It's like, okay, the perfect storm is there. The gene is there, it gets triggered by the
Yeah.
environment, usually by violence, witnessing it, or abuse and
And
sexual.
yes, happening to them.
Um,
Usually it's happening to them. So that triggers it. Yes. Very hard, especially if it's complicated by trauma. So when we go into treatment with it, you're not only treating the mood problem, the bipolar, you're also treating the trauma. So it becomes complicated. Yeah.
okay. And then, so how do you treat bipolar disorder, or like, what are the common treatments? And is there anything else, again, with the diagnosis? Sorry, you know me, I have so many questions that just come up. Um, they're not racing thoughts though, because I remember them. Okay.
Okay.
They don't slip out of my mind. I remember them, which is also bad because I'm like obsessive about it. I'm obsessive about getting my questions to you. Okay, so um, do you do any clinical tests also? Like, is it when you diagnose it and before you start treating it, is it an individualized treatment? Like, of course, the patient has to talk to you. And then how long does it usually take you to sort of diagnose them? And what tools do you use? Like, do you take their blood and see that there's some kind of imbalance? And then also, I guess, what are your other diagnostic tools? Are they clinical?
Well, the diagnostic tool is actually the psychiatrist, him or herself. Because again, as with all psychiatric conditions, we don't have any laboratory test that would pinpoint and say that, hey, you have this condition. We don't have that. Okay. So usually it's done through interviews. We interview the patient from childhood, what has been going on up until the present time. We have the diagnostic and statistical manual. Edition 5. This is very Western. That is where our criteria for diagnosing bipolar disorders would come about. So those kinds of things. Now, with regards to treatment, it will be medications. We have mood stabilizers that we give. Some of our other antipsychotics we actually give also for mood problems. The thing is, it will depend upon the symptoms that the patient would present, and that is what medications will be used. That is how I do it. Okay. Why? We have actually two types, especially for mania. Pardon me. Pardon
It's all
me.
right. All
Yeah.
right.
Sorry about that.
No, it's all right. Okay, so
Can I
this
call you later? I'm in an interview. Okay. Okay. Thank
he's
you
in
about
an interview, baby, with Nicole Jacinto here in Helena McCarty Man. Okay.
I'm so
Yeah.
sorry about that.
No,
Yeah.
don't worry about
So,
it. It's fine. I mean, I think these days we can be more casual and
yeah.
and show the reality. I mean, ever since COVID, these things happen, so we do that. That's so
Yes.
anyway, like it would just be so
Yeah.
nice, like an informal setting sometimes. But okay, since you're,
Okay.
I will not like drink Coca-Cola in front of you. That's here on the side, making me like,
I apologize for that. Yeah.
no, don't worry about it. It's fine. Okay.
We actually have two types of mania that comes about. We have what we call the classic mania. Classic mania are those that are very grandiose. I'm the queen of the universe. I can handle everything. All of these people are in love with me. All of them are bowing to my needs.
So there's a narcissistic element to it.
Yes, there is a narcissistic because they're very grandiose. It's
Yeah.
me, myself, and I. It's about me. But you can find that they're smiling, they're laughing, even if you try to contradict them. No, that's not true. I'm happy. That kind of thing. So that is what we call euphoric mania. That is classic mania. Now, if that is the presentation, usually what we give is lithium. Lithium is very good for classic mania. So
Mm.
I'll discuss lithium later.
Sure.
But if the mania is coming in irritable, hostile, aggressive, fighting with people, they're spending, but they're fighting, that kind of thing. That is what we call mixed mania.
Mania.
So, yeah, so those are two very different things. For mixed mania, it's not lithium. It's actually another mood stabilizer that we give, a sodium valproate, or maybe our second generation antipsychotics. So as you've said a while ago, I remember it, it's tailored fit to whatever symptoms that are coming out. If we have our target symptoms, we need, as a psychiatrist, I need to recognize the kind of mania that my patient is exhibiting for me to give the proper medication for that patient. Yeah.
And sometimes, does it take longer, doctor? Because, people don't always say everything in one session, right? Or
Yeah.
they don't always want to reveal, or maybe they just don't have enough time to reveal everything. Do you find
Well,
it's a bit
yeah.
like you already know, but you're trying to find out more of the, like,
Yes.
what kind it is?
So
Mhm.
you need to ask, the psychiatrist should have a high index of suspicion. So the psychiatrist would be able to ask the right questions.
Yeah.
So yes, so the kind of thing, how's your sleep? So, oh, you're not able to sleep. So for some, they will stop there. But for me, I will probe. Why are you not sleeping? It's either you're hearing voices, so that points to schizophrenia. It's either I'm so scared, I'm so fearful, could be anxiety, or I have a lot of thoughts that are going and it's exciting me. So racing thoughts could be bipolar. So it's a matter of really, it's like you're like an archaeologist. You're actually digging and digging until you find the bones. So that's how I see myself. Yeah.
I have found that there are good psychiatrists, and I know you're one of them. And I know I can tell, because sometimes you will interview someone or accompany someone to their psychiatrist or whatever, and you're like, oh my God, I can run circles around this person. This is not gonna, sorry, other psychs, but this is not gonna work, because if I can run circles around you, the person I'm accompanying can also manipulate you. Like, you gotta be on top of it. And everything you just said shows that you're a good psych. As you said, you're like an archaeologist, digging and digging and digging. And then for the medication, doctor, are there any side effects? Because, sometimes people don't want to take their meds.
Yeah.
The side effects here, the side of, and maybe you can discuss lithium and like some of the medications that I know that some of my friends take or have taken, they're at the tip of my tongue, but I don't want to say it in case it's like not the right thing, or like I might say a brand instead of the actual.
Correct. Correct. Yeah. Well, with lithium, I would always tell my residents regarding this, and when I do my lectures, I would tell them that I have so much respect for lithium, I actually don't prescribe it if I can help it. Yeah.
Okay.
Why? Lithium is actually a salt. It's a salt. It's in the periodic table of the elements. It's like that. Okay. So it started in the 1930s.
Yeah.
They would put lithium in sodas,
Mhm.
in soft drinks and everything, and then they would give it. And then they noticed that people actually improve. The mood actually improves once they drink the soda. So
Mhm.
they're thinking, what is in it? And it's lithium. So they started giving out lithium, but then because lithium has high toxicity, there's a little, there's a small therapeutic window for lithium. We really need to watch out for the levels. They went into lithium toxicity, and lithium toxicity is actually very bad on the kidneys. So
Okay.
they could actually die from it, dialysis and everything. So that is the problem with lithium. So lithium during the 1940s, the popularity went down because of that. In the 1950s, it was discovered again by
Mhm.
by the pharma companies that, hey, this is actually very good for mania and everything. The problem is they cannot patent it because nga, it's organic. So
Can't
they
patent it because it's organic. So yeah, so they
correct,
came up with
yeah.
brand names and like
Yes,
whatever.
correct.
Uh,
And they cannot put a stamp to it and say, hey, we discovered it because it's again very organic. It's a salt, so
yes.
it again lost favor. It was actually rediscovered in the 1960s by psychiatrists. The thing
Mhm.
is, because it is a salt, so it goes through the kidneys. Ang kalaban, usually the enemy will be edema, manas,
Oh.
mamanas. Okay. Another thing, when you get dehydrated,
Mhm.
then chances of your lithium levels actually increase and it could be deadly.
Mhm.
So usually what will manifest would be tremors, you will
Mhm.
have diarrhea, you will be vomiting. So usually those are the first stages of lithium toxicity. I'm not breaking confidentiality. Actually had a patient. That patient is a food blogger. Then was actually invited to blog a food festival in India. Okay, in Calcutta. So the patient went there around this time, April, March, May,
Yeah.
during the time that it's so hot, had food poisoning. So it's good that we had a very good therapeutic alliance. I educated, once you start feeling this, ganyan, ganyan, and everything, then he started feeling it. So there was sweating, he was tremors, everything, vomiting, diarrhea, had to call me. So, Doctora, I'm having this. I think I'm having lithium toxicity. And I said, most probably because of your food poisoning, you're vomiting, so you're becoming dehydrated. So I told him, you have two options. Number one, we stop the lithium, you stay in your hotel, you
Mhm.
hydrate yourself with a lot of Gatorade and everything. Or number two, you go to a hospital in Calcutta.
Yeah.
So the first was I just stop the lithium, and we were able to get him back home, after 1 week. But by the time, because there was no lithium inside of his body, of course, he's very irritable, he was already very manic, but at least he's already here.
Yeah. And
So
you can
yeah,
introduce it into his system without damaging his kidneys.
correct. And we can monitor, so that is the danger regarding lithium. It's only a very small therapeutic window, and the kidneys need to be monitored closely, and the levels monitored closely. Another that has an effect is actually has an effect on the thyroid.
Mhm.
So that is another problem that we have. Could cause hypothyroidism. Another thing, it actually could have an effect on the heart.
Mhm.
So those kinds of things that are involved when it comes to lithium. So that's only lithium. Then we have the other medications for the mixed mania. These are your mood stabilizers. Interestingly, these mood stabilizers, all of them are anticonvulsants. So
Okay.
they're anti-seizure medications. But serendipity, we found that they're actually very useful also for mania. So that's why we use them.
They
Another
can stop like the neurons and whatever
yeah.
from having the
Yes.
connecting and having the racing thoughts.
Correct. Yeah. So we have sodium valproate. Sodium valproate is one. We have lamotrigine. So those kinds, but those are anti-epileptic agents that we use to control the mood swings. So those are the things.
And then
Yeah.
doctor, oh my God, I have still so many questions. Sige, I'll let you talk, but just quick shots from
Okay.
me, quick shot questions like how why do patients stop their medication? Yeah, I noticed like they stop medication, then they go into a mania, or they stop medication, they go into depression. Okay. Why is that? And then
Okay.
also like the risk
Yeah.
of like them overdosing.
Yes. Especially if you're mania, if you're manic. Okay? Especially if you're manic, why will you stop something that is so pleasurable?
Yes.
And the medication actually brings you down.
Yeah.
When I started, I actually stopped. I actually had a poll, my informal poll inside my clinic. I stopped at my 26th patient. Why? So they will be brought to me, mania and everything. So we will control. I will be able to stabilize the mood. The parents are happy. I am happy. But when I ask my patient, are you okay? Your mood is already stable and everything. I'm telling you, 21 out of those 26 patients actually told me no.
Because they missed the high of the
I mean,
main.
I feel so safe. It
I
is
feel
so
so safe.
boring. It is
Okay.
so boring.
So we have
And
to understand that's why they do bipolar patients do that, because people who care for them get frustrated, like, oh my God, here we go again. Why did you stop
yeah,
it? So we have to understand. And then, okay, how does this affect their relationships?
of course, it will be very chaotic because as the caregiver, as the one who gives the medications, maybe the mom or the dad, and again, it will all be chaotic. Grades are going down. You're fighting with everybody. You're going out. You're not sleeping again. You're disturbing the household. So those kinds of things. But that's a point. Another would actually tell me, I don't know, Doctora, give me some time. It's like fitting into a new skin.
Yeah.
So yeah. So I
Nicole,
stopped at 26 because I'm losing. I'm,
yes.
I'm losing the poll.
Yeah.
Yeah.
I feel better now, so I'm gonna stop my meds, and then they go and do these things, and like I know someone who like just took a whole other degree, and then Jesus.
Yeah.
Okay, so I don't want to rag on people who have bipolar disorder, but this is how it affects relationships. I do have good friends who have it, and I'm there for you guys.
Hey, well, if they're stable, they're actually good people. They're very good people. Except that during those times when you don't have meds and you're in the throes of a mood problem, it's the emotions controlling you.
Yeah.
You should be in control of your emotions. And of course, when your emotions are controlling you, whatever you perceive from that emotion, that is what happens. Yeah.
My God, doctor, we're running out of time. So do you have any like tips for? Can you come back and talk about it again and then other stuff? Yeah,
Sure,
this is
no
a month,
problem.
doctor. Can we do that? Because
Sure.
a lot of people need guidance
Yeah.
and awareness.
Yeah.
So I sound like I'm complaining about just because I've been through it with people, but my friends who watch this, I love you. It's just difficult sometimes, and I can also be difficult even though I don't have the disorder. So patas lang tayo. Okay, any like tips, or I mean advice or anything, and
Yeah.
anything you'd like to say, you have the floor.
Yeah. People with bipolar disorders, you guys are capable of leading normal lives. You guys are capable of having families. You guys are capable of doing whatever you want to do. You guys are capable of going abroad and studying. The sky is the limit for you. But please be mindful. You have to be in control of your emotions. We are not in control of anything else. The only thing that we are in control of is our reaction to things. So I would like for you to achieve whatever you want, to be in control of, your reaction and your emotions. And
And you
that is
don't
perfectly possible. Yeah.
you don't need to be manic to
Yes.
achieve that, even if it
Correct.
makes you feel safe.
Yeah.
Siyempre nagdagdag pa ako. Thank you, doctor, so much. My gosh, I could not ask all the questions, but this has been such a meaty show. And please do come back soon.
Sure.
So please,
Of
please.
course. Yeah.
Thank you, doctor.
Anytime.
You're such a giving doctor. Like I've seen you once when we used to do this stuff in the studio, and you had like I don't know how many thousands of patients you're managing, and there were like suicidal things going. I mean, people who are suicidal, and you still talk about it because you want to raise awareness. So please come on the show more often.
Sure.
Anytime, glad to have you. Okay,
Thank
Makati
you.
Man, please bring Dr. Charm on the show more often. Thank you. Thank
Thank
you,
you so
Dr.
much.
Charm.
Goodbye.
Great
Nice
doctor. I
seeing
know
you.
you have many patients, but if you want the best, I have a number. I know who they are, and Dr. Charm is one of them. Thank you so much, Dr. Charm.
Thank you. Yeah.
Can
Good
I have
night.
your number after the show? I think I
Pardon?
have. Can I have your number after the show? I think I have it, but I'm not sure if
You
it's
have it. Okay. Sure.
okay.
Yeah.
Thank you. Okay, guys. So there you go. Bipolar disorder. I mean, we discussed it, and of course, if you feel anything, you need help, please reach out to a mental health professional. You can trust them. Maybe not all. If you don't feel like it, go to people that you can trust. There has to be that relationship. Thank you, Dr. Charm.
Thank
Okay.
you. Bye.
Bye-bye.
Thank you for tuning in to Healthline with expert doctors from Makati Med, giving you the chance to interact, uplifting your lifestyle. Moderated by Nicole Jacinto. Tune in again next week for your weekly dose of Healthline.
The views and comments of the hosts and guests are not necessarily those